Down syndrome is the most commonly occurring chromosomal abnormality. It occurs when a person has an extra copy of chromosome 21. So for this reason, we sometimes call it trisomy 21. This presentation is going to talk a little bit about the history and overview of Down syndrome. I'm also going to go a little bit into the genetics behind it and talk about the nursing roles and implications and give an example nursing care plan. As well as that, I'm going to talk a little bit about some genetic testing options that are available and a little bit about the ethical debate behind Down syndrome. The picture to the right dates back to about 2,500 years ago, and it depicts a person who shows signs of Down syndrome. Down syndrome was first named for John Langdon Down, who was the doctor who recognized the symptoms in 1866. However, the cause of Down syndrome remained unknown until about the mid-20th century. In 1956, when extensive research was done on human chromosomes, that's when they realized that an extra copy of chromosome 21 could be found in patients with Down syndrome. But it wasn't until 1959 that it was determined that this extra chromosome, which we now sometimes call trisomy 21, was the cause of Down syndrome. Now, most cases of Down syndrome, around 95%, are caused by non-disjunction of chromosomes. But in the late 1950s, it was discovered that approximately 3 to 4% of cases are caused by translocation. And adding on to that, about 1% of cases are caused by something we call mosaicism. But we'll get into all those later on. As previously stated, Down syndrome is a chromosomal abnormality. There are 3 types of Down syndrome. Trisomy 21, which accounts for about 95% of cases, is the most common. This occurs when a person has 3 instead of 2 numbered 21 chromosomes. Translocation is the second type. This is when part of chromosome 21 is broken off during cell division and is attached to another chromosome, usually chromosome 14. This type of Down syndrome can be inherited if a parent has balanced translocation and passes unbalanced translocation onto the child. The third type is mosaicism. This occurs when non-disjunction of chromosome 21 occurs in not all cells. The patient will then have a mixture of cells having 46 and 47 chromosomes. Because Down syndrome occurs from a random event in the reproductive cells of the parent or during cell division and fetal development, it's not usually inherited. There's also a high degree of phenotypic variety in people with Down syndrome. Translocation essentially occurs when parts of chromosomes swap places. So as you can see in the picture with balanced translocation, chromosome A, which is purple, and chromosome B, which is pink, flip places. A parent with balanced translocation can pass unbalanced translocation onto their child. So the picture on the bottom shows unbalanced translocation. That's when the child has all of chromosome A, but part of chromosome A is attached to chromosome B. There are no health problems associated with balanced translocation because the person still has all parts of the chromosome, but unbalanced translocation can result in health problems such as Down syndrome. There are a few physical features that we usually associate with Down syndrome. So a few of them are almond-shaped eyes, a shorter neck, smaller hands, feet, and ears, short stature, and a flattened face and a flatter bridge of the nose. Some other ones are displacement of the tongue. So patients with Down syndrome usually have a smaller mouth, so that can sometimes cause their tongue to protrude from their mouth. They also have decreased muscle tone. They can have immune deficiency, which causes them to have an increased risk for infection. Usually they're more overweight. They usually have thicker skin on their palms and soles, and they usually have a lot of vision problems. So those are a few things that the nurse can identify when assessing a patient. Now there are also a lot of other complications such as heart defects, gastroesophageal reflux disease or GERD, sleep apnea. As I mentioned before, they have a tendency to be obese. They usually have dental, vision, and hearing problems, and a lot of them suffer from thyroid dysfunction. The nurse plays an important role as patient and family advocate. It's important that the nurse and caregiver understand that each person with Down syndrome will have different signs and symptoms. Because of this, the plan of care for each patient will be unique depending on the individual case. The nurse also has to assess emotional coping. How well is the family understanding the illness? Are they dealing well with the diagnosis? Do they have a strong support system? Understanding the illness can help ease anxiety, so education is very important. Patients with Down syndrome are at an increased risk for infection. Teaching ways to decrease infection risk, such as hand hygiene, avoiding large crowds, signs and symptoms of infection, such as warmth, redness, and swelling, and encouraging a yearly flu vaccine are helpful. For younger patients with Down syndrome, education on proper positioning of patient is also important. Because of decreased muscle tone and increased joint flexibility, the patient is at increased risk for injury. It's important to encourage development of fine motor skills early on, such as those involved with feeding. Young children with Down syndrome may need extra help during feeding and may benefit from special utensils, bowls, plates, etc. Because patients with Down syndrome usually have comorbid chronic illnesses such as cardiac effects and thyroid dysfunction, teaching about regular doctor's appointments and screening for chronic illness should also be included. There are a lot of nursing care plans that can be developed for patients with Down syndrome depending on their individual case, but what I picked is risk of infection related to decreased muscle tone. An appropriate goal to set for this patient would be the patient will be free of purulent drainage, erythema, and be afebrile with proper wound healing. Some nursing interventions that can help meet this goal are to provide adequate nutrition with a diet high in protein to promote wound healing, to educate the patient and family about signs and symptoms of infection, and to assess understanding about the illness. So to evaluate, you would want to see if the patient is free of signs and symptoms of infection, if they have timely wound healing and are afebrile, and if the patient and family express understanding of illness and proper nutrition. So it's difficult to narrow down risks for Down syndrome because of the random process in which it occurs. But there are health promotion tips that we can teach to families, such as ensuring a balanced diet and adequate exercise to maintain the proper weight, and to make sure that the client goes to doctor's appointments regularly to monitor their cardiac function, their thyroid function, and any other patient-specific symptoms. So again, it's really important to know the unique case that your patient has in order to properly educate the family. It was previously thought that patients with Down syndrome should be kind of sheltered and shouldn't be allowed to do much, but it's actually been shown that it's really important to expose children with Down syndrome to motor exercises that will help improve motor control later on. Some ways that they can benefit from this is that it increases muscle tone and strength, which can then help combat things such as risk for infection and risk for injury. Focusing on motor movements has also been proven to increase cognitive function. Some other things to consider are early exposure to speech therapy and physical therapy can help them develop their speech and develop their muscles early on. So because most cases of Down syndrome aren't inherited, it's difficult to genetically test to see if a parent is going to pass Down syndrome on to their child. As we've said before, really the only way that can happen is through translocation. So I've named a few genetic screening options. So the first one is fluorescence in situ hybridization. That is when fluorescent dye is injected into DNA sequences to detect chromosomal abnormalities, such as the presence of an extra copy of chromosome 21. A few others include nuchal translucency, which is a physiological marker that shows lymphatic and vascular progression in the fetus. Now, this is also used in combination with maternal age because women over age 35 are just as likely, if not more, to lose their pregnancy as they are to have a child with Down syndrome. Absence of a nasal bone is also indicative of Down syndrome. So usually if there's no nasal bone by 11 to 14 weeks gestation, the child will have Down syndrome. So since prenatal testing became available, the population of patients with Down syndrome has decreased significantly. So that kind of leads into the question, is it ethical to terminate a seemingly healthy pregnancy, based on the fact that the fetus may have a chromosomal abnormality? Now, this can lead into a lot of moral and religious debates, but we're not going to go into that. It just leads into the point that patients with Down syndrome are living longer, healthier, fuller lives than before because we understand the disability better, we understand treatment options, and there are a lot of advances in medicine. So as members of the healthcare team, as nurses, especially who play advocates for their patient, it's really important that we withhold judgment and we withhold our personal views on the topic. We need to provide the patient with the correct information and also offer emotional support because this is a hard thing for some parents to hear. So it's important that we, do tell them that patients with Down syndrome are able to maintain relationships. Some are able to hold down jobs. Most are able to go to school. Some can even play sports. There's just a lot of advances that we've made, but that also is to say that there are a lot of challenges. So it's really important as the nurse to make sure that we're providing our patient with the proper information and also emotionally supporting them, encouraging them to talk about how they feel about the potential diagnosis, and really just being there for them while they're making that decision. So just to kind of wrap up, Down syndrome is a chromosomal abnormality that can present itself in a lot of different ways. So as a nurse, it's really important that we are able to identify signs and symptoms and understand the implications that they have on our patients. So Down syndrome can't be passed from a parent to a child unless translocation occurs, and this is about 3 to 4% of cases. So it's really rare that that happens. In the other 95-ish% of cases, Down syndrome is caused by a random event. So it's important that we know the unique patient case and know the different manifestations that are affecting our patient in order to provide proper patient care. The nurses need to be advocates for the patient and for the family, educate on risks and health promotion, and be a supportive presence. There are a few genetic screening options that are available, and these can be done prenatally to identify the presence of Down syndrome before the baby's born.